Hello and welcome to the Through the Pain podcast. This is a place for chronic pain and chronic illness warriors to dare, dance, and dream through the pain. Hello, everyone, and welcome to another great episode of the Through the Pain podcast. Today, I have another warrior interview, and I'm so glad we're going to chop it up with Dana Kiwacz. She is a life coach, a sickle cell warrior, business coach, and she does so much in spite of sickle cell. She's doing it all through the pain. So welcome, Dana. Thank you for joining me on the Through the Pain podcast.
Thank you, Dima. So nice to be here. And I just wanted to really say, I really appreciate you having me on your show. And I hope that our time together is a blessing to others that are going to be listening in.
I know it will be, because you have graced us with your presence and you are a fellow survivor and warrior. So again, thank you. I'm going to just get right into it and ask if you can share a little bit about your sickle cell journey, diagnosis, and if you want to talk about your evolution with sickle cell disease.
Sure. Yeah, great question. So I was diagnosed at 6 months of age. I am the youngest of 4 siblings. So as you know, when both parents have the trait, there's a 50-50 chance. And I was the 50-50 chance. So out of the 4 children, I have the full-blown sickle cell SS anemia. And that meant a lot of limitations, a lot of doctor visits, and it came with almost like an expiration date. So what I mean by that is the doctors, much like you've had, I'm sure, would tell my parents, she's not going to live past the age of 6. And if she makes it past that, she won't live past teenage years. And so it was always kind of a bleak outlook. There were no therapies for treatment for sickle cell. I had intense pain. We had an in-ground pool growing up, which was so much fun, but it was also the source of pain for me. So every time I'd swim, the cold would trigger a crisis, and I would get into a hot shower and try to fight it as fast as I could. And if I couldn't, that meant a trip from New Jersey, where I live, all the way to Philadelphia Children's Hospital, where the experts were for sickle cell. And so when I was 6, I did nearly die. I had a really bad crisis. I guess my mom explained to me that we were out like at a revival somewhere in upstate New York, and any high elevations cause a crisis for me. And so I had a really bad one. And when they rushed me to the hospital, the doctors had told my parents that was pretty much it. And I remember during that time, I had seen a hand come towards me to take me to heaven. And I said, no, I don't want to go. I want to stay with my mommy and daddy longer. And he said yes. And so when I woke up, I explained to my parents what had happened. And my mom said, Dana, if Jesus ever comes for you, you take his hand, it'll be okay, and we'll see you on the other side. And I said, there's no way I'm doing that, because I wanted to stay with my parents and I wanted to live life. I was just naturally curious for what life was about. And so I had that second chance granted to me at a young age, and it reshaped how I looked at a lot of different opportunities that came my way in life. And it spurred the natural curiosity that I had for people, for science, languages, cultures, everything I could get my hands on, I wanted to learn. It also spurred my curiosity around human behavior. And I'm sure, Dima, you've had the experience of different treatment in different emergency rooms. And I always wondered why some doctors would care for me like I was their own child when I was in a lot of pain. And other times, other physicians or healthcare professionals would leave me in pain and treat me as less than human. And so that spurred a lot of my curiosity into human behavior and sickle cell specifically, and what stigmas were associated with sickle cell and the healthcare disparities that we face on an everyday basis. It's not just me, we're in this all together. And sadly, it's still ongoing, and it's something I'm really passionate about advocating for at the local level with legislation, and also at the Hill. So that's a little bit of my journey. I'm grateful to my parents for giving me as normal as a life as they possibly could to equip me with the belief that I could do and conquer anything. And I now pour that same belief into others, whether their pain be sickle cell, or the pain of just defeat to their own self-limiting beliefs, that they can do and accomplish whatever they set their mind to. It's just really critical to manage your mind so that you can fulfill the future, and the future vision that you have for yourself. So that's a little bit about my journey with sickle cell.
I'm so glad that you are here, you're alive. I feel that you are a miracle. I think everyone with sickle cell disease is a walking testament and testimony,
Mhm.
and we're living miracles. I just wanted to highlight or go back to something that you said when you were talking about your journey. You mentioned the pool, which
Yes.
is a source of fun, but is also a source of our most painful crises. But you
Mhm.
also mentioned having to travel from New Jersey to Pennsylvania just
Yes.
for care. I wanted to go back to that because what I just don't understand is, and I want to kind of try to figure out now, um, are all the states not able to take care of sickle cell warriors? It's This is a little bit of a little problem here if you have to travel all the way from New Jersey to Pennsylvania. You said Philadelphia specifically.
Correct.
Um,
Yeah.
so Philadelphia was the center of care, I'm
Yeah,
assuming.
Children's Hospital is a famous hospital where a lot of the experts were for sickle cell disease, because to your point, unfortunately, in New Jersey, I say it's the crisis of suburbia. Sickle cell in the suburbs is a blog that I'm eventually going to write, but there's very little access to care here in terms of people who actually are familiar with sickle cell.
Mhm.
Many of the hematology oncology physicians that I see, they practice 99% oncology and 1% hematology. And even the practice I am a patient at, they no longer even accept sickle cell patients. So my parents, I mean, this is present day, but back in the day, now I'm 39,
Mhm.
but back in the day, my parents had no options. And so the only option was to go to Philadelphia, Pennsylvania, which is about an hour and 20 minutes without traffic from here, every time I had a major crisis. And if we had gone to local ERs, the outcome was not very good. So they felt that that was the best, in terms of knowledge and care and what to do. They had set protocols for what to do when someone is in crises with sickle cell, versus other emergency rooms had no standardized approach, and you could be left in pain. So it could go from a simple emergency room visit to a really expensive hospital stay, and most importantly, the expense it costs on your organs and your body when everything is in crisis and your blood cannot flow and oxygen can't get where it needs to get. And so they were just tired of having to deal with that locally in New Jersey, and just would every time go to the experts when we could get there.
And how long was that drive?
Hour and 20 minutes without traffic.
Oh my gosh.
Yes.
Now,
Yes.
when you would arrive at the Center of Excellence, would you have to wait in the emergency room or would have to wait to be seen on top? I'm just trying to figure out time on top of that hour and plus ride. Like, what was the time between I'm having a pain crisis to I'm being seen?
Yes. Thankfully, there, when I was younger,
Mm.
my mom would call ahead of time and let them know. And I saw Dr. Frampong, who's still a great physician today, and they would pretty much have everything ready to go for me to get right in and be seen. It was more as I became an adolescent that was the worst, transitioning from pediatric care into adult care, or even adolescence, where I would really have to wait, especially if I went on the New Jersey side to the emergency room, or if we were traveling, which we did frequently, and you're visiting a different emergency room. They would literally wait and they would test my reticulite count to make sure that I was actually in a pain crisis, because they wanted to make sure that I wasn't there just to receive narcotics. And so that was pretty standard. I would have to wait and the pain would, as you know, escalate. And then it's okay, yeah, it looks like your blood test results are showing that you are really in pain. So we'll take you back and give you some fluid, oxygen, and painkillers if necessary.
So the thing with that is our blood counts really don't tell if we're in pain. I'm having a little bit of a problem about
Yeah.
what is presented. Because, um, there's no way that our blood count could say we're in pain. Um, was there a time where that you did the test and they said, no, you're not having a sickle cell crisis and you're drug seeking? Was there ever a time that you ran into that problem?
No, so actually they standardly would do that test to look at the like how quickly things were breaking down.
Mhm.
And when they every time it would show according to their diagnoses, oh, she really is in acute pain. And
Mhm.
so the problem was they would secretly decide what they were going to give me. So my mom and I and whoever was in the emergency room at that time would say, why is she still in so much pain? Why is it still escalating? And that's because even though they would speak to my hematologist and find out this is exactly what she needs, it's how many milligrams she needs to get ahead of the pain, they would say, yeah, we see she's in pain, but we're just going to do our own thing. And they would use whatever their own self-determined protocol would be. And sometimes that's because they believed that with the stigma of sickle cell that, oh, she might just be drug seeking. So let's just give her something to take the edge off the pain, but not really give her what she responds to innately. And as you know, each person responds to therapies different. That's what makes us unique. That's how we've been created. And some people respond to different therapies. But when you have sickle cell and you know your body and you know it works, unfortunately, you're left in the hands of that provider to determine if they're going to actually give you that.
So usually I hear a lot of about this bias that you're speaking of as an adult. It sounds like that this was happening when you were a child. And
Yes.
that this is astonishing to me. This is pretty new to me. Um, do you still receive that treatment now today?
Absolutely. Yeah. So I was just recently pregnant, and pregnancy triggers crises for me more often than I would normally get at pain crises. And I've had to go to the emergency room and told the doctor flat out, this is what she responds to. My husband was with me because it's really important to always have an advocate, as you know, to speak when you can't speak and when you're in so much pain. And I called my hematologist, and the doctor was like, what are you calling your doctor for? You're going to take what I tell you you're going to take. And I
Oh,
said, excuse me? And I literally thought I was in like a hidden camera show. I'm like, she was so rude and so nasty. And who refuses to call your treating physician to find out what you normally take and what you respond to? But she didn't want to. And in fact, even in that case, I waited over an hour and a half just to get an IV fluid, which for me, just getting the IV fluid and hydration is 90% of the battle before I need anything else. And especially being pregnant, I like to do as much as I can without having to take narcotic. And so that was my plan, but they barely gave me the IV fluids. And then once it was time for pain medication, she refused to speak with my hematologist and find out what I responded to. She flat out said, you're going to get what I give you. And if that doesn't work, then we'll see if I can give you what your hematologist wants, but you don't just come in here telling me what you respond to. So that was just a few months ago.
okay. Okay.
Yeah. Very upsetting.
This is a little bit of astonishing to me. I know we're taping a podcast, but I'm trying to be calm. Because there's a little hood Dima in me that's like, no, she didn't. And I'm trying to be very, woosah about what I'm hearing right now. Because it's 2022
Yes.
and you are an intelligent, accomplished woman, and
Thank you.
you're going to the hospital and presenting and you're saying that you're in pain and you're not being believed. And it's still something that occurs and it's outrageous. Um, and if they look in your chart, it's you don't present as a drug seeker. You do not
Correct.
In fact, I don't even like the term drug seeker.
Mhm.
Um, one of my colleagues said, yes, you are drug seeking because you're in pain. You need to seek the drugs because you are in pain. However, you're not an addict.
No.
You don't present as an addict. So, and you don't have addictive behaviors or qualities. So it's just, I'm finding it very, very disturbing that you had to go through this. And this is something that you're still having to deal with in this day and age.
Yes.
Okay, I'm going to shift gears a little bit. Exactly.
Sure.
Shift a little bit. I want to talk about what you are doing. Um, and despite being, despite the bias,
Mhm.
despite, being judged by medical providers, you are a life and business coach. And just for that, congratulations to
Oh,
even
thank you.
make that step. Tell me a little bit about your business.
Sure. Yeah. So the Inspired Life Design Studio is the name of my company.
Mm.
And I started it in honor of my father, to honor his legacy, and also my mom. So my father unexpectedly passed away my freshman year of college.